Hello, today we will be exploring working as a physician with University of Virginia alumni. I'd like to welcome our guests, Amy Caruso Brown, Assistant Professor of Pediatrics and Bioethics and Humanities at Upstate Medical University. Welcome, Amy.
Thank you.
We also have Kartik Krishnan, Senior Medical Director at Genentech. Welcome.
Hi.
Did I get your name right?
Yes, very good.
Okay, good. We also have Kristen Pendergast, a physician at the Children's Hospital at Lee Valley Hospital in Allentown. Welcome, Kristen.
Thank you.
We have Nishant Patel, radiology resident at the University of Michigan Health System. Welcome, Nishant.
Thanks for being here.
It's a little bit quiet, just so you know. All right, wonderful. And we also have Kenneth Harkavy, Director of Neonatology at the Weston Hospital Center. Welcome, Kenneth.
Hi.
All right, so let's dive into things. So why did you choose a career as a physician? We'll start off with Amy.
I'll try to keep it short because it's a long story. I always liked science and was good at science, but I was very interested in law and in international relations and global health in 2002, and it wasn't a great time to want to be a human rights lawyer, so I went to medical school instead.
Excellent, wonderful. All right, so Kartik, what about you?
So I guess I've sort of always wanted to be a physician. I actually have the opportunity to visit my parents' home since I'm on a trip now in DC, and they are fond of showing me my stuffed animals that have little red marks where I was giving them their shots when I was 2 and 3 years old. So yeah, they showed them to my kids, which is slightly embarrassing.
I love it, wonderful. All right, what about you, Kristen? Why did you choose a career as a physician?
So I also knew from a young age that I wanted to work in the field of medicine. My mom was a daycare provider out of our home for 20 years. And so I always grew up around a lot of children. And so for me, medicine and pediatrics it was just a big interest of mine from a very young age.
Wonderful. And Nishant?
Well, unlike my colleagues over there, I actually did not want to be a physician when I entered college. My parents were both physicians, so I was exposed to the field. But I quickly realized that the sort of intellectual challenge that comes with being a physician that is with you every day was really what I wanted out of my life. So that was the kind of end game decision.
Wonderful. And Kenneth, why did you choose a career as a physician?
It happened so long ago, I'm not really sure, but I do know that it fit my interest in science and math. I was always enjoyed school, and I think that I really had no role models for that. But my sister was also older than I, and she had also anticipated being a physician. So I think it was just, to me, it was a good career fit, and fortunately, it turned out to be right. And I enjoyed it, the journey from then on.
Wonderful. So what were your biggest challenges in your first year of work? Let's start off with Nishant, because you're a radiology resident right now. So what are some of the biggest challenges you're facing?
Yeah, I mean, when I read that question, it's interesting because where do you start with first year? I mean, is it their first year of med school, first year of residency? So I'll take it from the first year of med school. I think that initial phase was, what they say, drinking out of a garden hose. It's a lot of information, and I think parsing through, how and what you need to learn was the hard part there. Ultimately, you realize you need to learn the concepts and back it up with the details, and that's how you really have the information stick with you. Then as we approach, radiology is a little different. We do an internship and then a full residency. So I did a 1-year internship down at Newport News. Relaxing year, but I quickly learned, the major problem with medicine is dealing with the people involved in medicine, whether it's the support staff or the patients. So you learn quickly to deal with people, which is not something necessarily I learned in medical school. And then finally, as a radiology resident, it goes back to the information. So it was, how do you sort out all of this information that's so excessive everywhere, and then learn how to manage it appropriately? And I think that ultimately now nearing my end of residency is something I've been able to reconcile.
Wonderful, thank you. And Kristen, what were your biggest challenges in your first years?
So I think, again, I agree. It's hard to know what your first year is, but I think for me, when I think about where my biggest challenge was, I'll talk about sort of my first time as an attending after residency. I moved home. I did my residency in Colorado at the Children's Hospital Colorado, and then following residency moved home to New Jersey, and worked I'm a hospitalist, so a pediatric hospitalist. So worked at the Children's Hospital of Philadelphia as a hospitalist, as a nocturnist, and then worked in one of their community settings as a daytime hospitalist. And I think for me, the biggest challenge was balancing home and work, because at that time I also had my first child. And so I was raising my daughter, and my husband's in medicine as well. He's in emergency medicine. And then myself, and from where I live, commuting was a bit of an issue. Philadelphia is about an hour and 20 from where I live. So I think for me, the hardest thing in my first year was figuring out that balance of family and work, and also the idea of no longer being a resident, and now you're the attending and you're the one in charge and making decisions, and overnight being the only one there. And so I think those were my biggest challenges in my first year. And it came, I was fortunate enough to work in a place and be surrounded by enough family and friends that I never really was by myself. And but to just get through that and to develop the confidence you need, and in both settings. So
Wonderful, thank you. What about you, Kartik?
So I think that we would all agree that describing your challenges in your first year, there's very different, first years, as Dishant and Kristen have said. And so I think that ultimately the challenge in any of those first years is to come to an understanding of what is expected of you professionally, how you can achieve a work-life balance with this. And I think it speaks to sort of the career as a physician, is that there's many ways to do it. Right now, I mostly am involved in drug development. And so my first year in biotech was very different than my first year on faculty, seeing patients full time. And so I think it's trying to understand where you are on the learning curve. It's usually pretty low, and it's pretty steep. And trying to navigate that in the setting of work-life balance is probably the challenge of any of the first years.
Wonderful, thank you. And what about you, Kenneth? What were your biggest challenges in your first years?
Your timing is impeccable. I lost everybody for a while, but anyway, I think I would second whatever I've heard, what I've heard so far. That if you consider your first year on career as med school, then there are challenges there. But my favorite anecdote was as a first year attending at a NICU in Baltimore, and in those days we had 2 people at my institution, about 2 or 3 at the sister institution at Hopkins, and my senior faculty member said, I'll take the first month to give you a chance to get acclimatized, and then the second month you'll be on. And what I didn't realize is that everybody but myself and one person at Hopkins left town for the entire month of August.
Oh no!
And you realize then that it's no longer a learning experience where somebody backs you up. It's you're the boss, you're the person responsible, and that's where you get the knowledge that your patients are in your hands. And I think that was the biggest challenge for me at the time.
You're gonna dive right in. Great. And what about you, Amy? What was your biggest challenge in your first years?
Yeah, I agree with what everyone said. I mean, every first year is different, even the first year. So I'm a pediatric oncologist. Even the first year of my fellowship was very different from the second year of my fellowship, which was all research. And then when I finished my fellowship now about 2.5 years ago, I took a faculty position at a medical school in which medical education, and my background is in medical anthropology as well. So I do medical education and bioethics and public health. And it was very much something that I had experience in, at least the public health and ethics part, but not so much the teaching or really directing a course. And so everything in my first year was learning a whole set of new skills and continuing education that were not really a major part of my training up until that point. So I think that was the biggest challenge, is it was just a whole new world.
Yeah, that makes sense. All right, so can you describe a typical day or week? Let's start off with Amy.
So every day is really I love my job a lot. It's very different than most jobs though, and every day is really different. So I'll do a more typical week. So I see patients about 30% of the time. I have one clinic day a week. So that's usually Tuesdays, and that's more of a typical day. I go in, I see cancers and blood disorders in kids, see patients I know, see consultations, do stuff like that. On Wednesdays, that's my big direct. The first and second year medical students have a longitudinal course in bioethics, public health, social determinants of health. So I teach a small group on Wednesday mornings, and then also spend a lot of time writing the curriculum for that course, doing faculty educator development, troubleshooting things with the course. And then the other days are sort of a mix of, I work with our ethics consultation service, so we'll have meetings to go to. I do a lot of research in ethics and decision making. So I'll have meetings about research or interviews with families who are participating in studies, sort of all kinds of different things. So those days can be anything. I try to take at least one day to just write, because it's hard to write if you're constantly getting interrupted. So to work on papers and manuscripts. And I just found out this morning that we're publishing our course as a book. So that'll be a whole other thing to work on now. So that's a pretty typical week.
Congratulations, that's great.
Thanks.
All right, so Ms. Shant, how would you describe a typical day or week?
As a radiology resident, I'm fortunate enough that usually our schedules are fairly predictable. So we kind of work shifts, meaning that one person covers a certain amount of time. However, I'm also, pursuing or going to do interventional radiology, which is a much more sort of surgical type of hours, meaning probably work up to about 80 hours a week, and that becomes much more less predictable, I guess I should say. So, we'd be called in overnight or on the weekends for emergent cases, as well as we don't really know when these are going to happen. So I'd say, a typical week in my future career is basically going to be come in, do some scheduled procedures, and then be prepared for, unknown sort of patient treatment encounters, and just be excited that you get to do all of these things while enjoying every minute of it.
Wonderful. And Kenneth, how would you describe a typical day or week? Kenneth, can you hear me? All right, we'll jump into Kristen real quick. How would you describe a typical day or week?
Yep. So I'm a pediatric hospitalist. I work at a children's hospital about 30 minutes from where I live, and so my time is mostly clinical. And so when I'm on service, we start rounds where we have the entire team, which includes pediatric residents, emergency residents. We have medical students from the University of South Florida, physician's assistant students as well from DeSales University who join us, and it's a very traditional teaching service at the Children's Hospital, Lehigh Valley. The other thing I really like about our hospital is that as a hospital service, we care for all different kinds of patients. So we have on our service patients with cancer and patients with blood disorders. We cross-cover some of the surgical patients. We have cystic fibrosis patients. And so we get to see a really big variety. And so we will round and go visit all our patients from around 8 a.m. till noon. And then the rest of our day is spent either doing lectures or spending time with our radiologists, reviewing studies, and seeing new patients as they arrive. And again, I only care for children that are hospitalized for different reasons, so I don't have any clinic responsibilities. And then, we sign off or hand off to the night team around 6 p.m. and then the night residents and night faculty are on. I do all different shifts, so I can do day service, or I also do overnights. And then on overnight coverage, the way it works at our hospital is the attendings are at home, and so there are residents in-house overnight, and we as the faculty are on call from home and have to go into the hospital for emergency reasons or kids transferred to higher level of care. And then on the weekends, it's sort of it's somewhere in between. And so on an average week, I'll do maybe 3 days of day service and 1 or 2 overnights a week. And the rest of my week is spent with my family. So I have 3 children, and again, my husband, and the rest of my time when I'm not on service is home. And then specific to my interests, I do a lot of stuff at work with like pathway development and order sets, because a lot of where hospitalist medicine is going towards the use of clinical pathways to try and standardize care. But it's that's sort of what an average week will be like for me. A little bit of home, a little bit of work.
My goodness, and trying to go back and forth with the schedules of it's nighttime, it's daytime, and I mean, that's amazing.
It gets a little confusing, but it kind of does work.
That's so impressive. All right, Kartik, so how would you describe a typical day or week in your current position?
So I think my experience is a little bit different in that, I work with molecules to try and determine if they are drugs, and if they are drugs, who would be most benefited from them. So mostly what I do is manage. So I start and manage clinical trials of medicines in development. So I spend a lot of time talking with the scientists at our institution and other institutions to understand what the effects are of these particular molecules, and then with internally the clinical trials support staff to understand what are the trials that we're running and looking at the data from them, and then also with colleagues who work with health authorities like the FDA to try and understand how we can get these drugs approved and to patients. At the same time, we want to understand what's happening in the field and with the investigators who are doing our clinical trials. So I actually spend probably about 1 week, at least one time a month, I'm traveling. So, for example, this week I'm traveling to the American Association of Cancer Research, AACR meeting, which is in DC. But I have a couple of other conferences I'll be attending, and since we're global, it means that I have to sometimes fly all over the world to visit either investigators or conferences.
That's amazing, and trying to be able to do things in different countries and what their practices are there and being able to adapt, that's so impressive.
Yeah, it's you learn a lot about different places in the world. I once made a 24-hour trip to Seoul, so that's 12 hours in a plane there, 12 hours in a plane back, and 24 hours in Seoul. So I know where, to get a quick bite in Korea if you need one. And navigating the mass transit system in Korea is challenging. So, yeah.
I hope that was an intended pun, a quick bite. That was brilliant.
Yeah, I was going to make a soul food joke, but
I love it. All right, great. So do you have any recommendations for how someone could prepare for and succeed in getting a job as a physician? Let's start off with Amy.
I would just say, because my career has been really interesting and taken a lot of turns, that I think the best thing and the best preparation have been everything that I explored that really interested me, that I was really curious about, or that I was passionate about. Because particularly now, particularly now in my position, everything I ever studied comes back to be relevant in some way. All the little classes I took that didn't seem like they were directly related, but were just sort of interesting to me at the time, because I'm teaching a really broad course that covers a lot of social sciences. All of those little pieces and things I picked up along the way, all of the countries I visited, really everything I did is relevant and helpful and has helped me be a better doctor. So I would encourage people to just explore and not worry too much about doing specific things to be a doctor someday.
Wonderful, thank you. What about you, Kartik? Do you have any recommendations for how someone could prepare for and succeed in getting a job as a physician?
Well, I'll tell you the two things I always give as advice for success. I think preparing for, as Amy said, explore and hard work is really the key to preparation. But in terms of success, the two bits that I always come back to are look for people who will be quality mentors in whatever position you have. Somebody who will take an interest in your education and your career, because that's always helpful to have somebody who will tell you you're on the right path or you're not on the right path. So the quality of mentorship really has defined the quality of each of the positions I've held. And the second thing I always tell people is you don't learn more by doing less. So, when you are a medical student or you're a physician, the ones that I've found that are most successful are the ones that stay longer and see that extra patient, because they then just learned that much more. And that was true in the lab as well. So.
Wonderful, thank you. And Kristen, any recommendations?
No, I very much echo what was said before me. I think that I agree. I think it seems like a very long road when you're standing at the very beginning, and it can be very overwhelming. But I think if you're following your interests along the way and taking it one step at a time and just doing your best and making sure you're happy at each phase, I think you will, in the end, be a better physician. And just remembering that there are lots of different ways to take care of patients. And while I think I have the best job in the world, I think that there are many different ways to practice. And if being a physician isn't right, then sometimes being a physician assistant is. Or so I just think it's always good to step back, maintain an open mind, and really take care of yourself and follow your passions. And I think if in the end you get to be a physician, then that's awesome.
Yeah, I love that. Thank you. And Nishant, any recommendations?
Yeah, I think in one word, alignment. You need to align your personality with your, your specialty, whether it's in medicine or outside of medicine. Align your passions with your career goals. So make sure you're doing what you set out to do. And in order to do that, I think you need to, sufficiently explore the future career that you're going to be aspiring to. So meaning, take your opportunities undergrad or in the medical school to really see what people do on a day-to-day basis, because I guess the largest sort of defector from the medical field is that I got in to do patient care and all I'm doing is paperwork and things like that. And so I would say, make sure you know what you're getting into, stay up to date with the current, politics of medicine, etc., just so you have clear expectations for the future so that your ultimate career is aligned with what you set out to do.
Wonderful. And Kenneth, do we have you back? Can you hear us?
I hope I come in and out of your program. So am I there?
Yes, you are. So do you have any
Okay.
do you have any recommendations for how someone could prepare for and succeed in getting a job as a physician?
Well, the good news is that once you get into the track of being a physician, it's fortunately for most situations, a pyramid so that you can follow you through with your
I think you're starting to break out there, Kenneth.
that I work with. Training, you have an idea of what kind of practice you would like to be. I think, for example, in medical school, the opportunities are there to explore the practice you want, whether it's medicine, pediatrics, radiology. And that's how you select your postgraduate.
Kenneth, can you hear me?
For me, and I think for most people, is that's where you find out what area of the specialty. For me, it was two choices. One was to work with adolescents. The other was to work with babies. Plenty of.
Kenneth, can you hear me? Because I think you're breaking out quite a bit.
The area I wanted. I think that's how you come to practice. I remind all the students that.
Kenneth, can you hear me?
Now is
Kenneth?
very different from medicine that I.
Kenneth? Hello? All right, well, I think we may have.
What anybody can.
I don't know if he can still hear me, but I think we may want to go forward with jumping on some other questions because it keeps jumping in and out. So let's start with what do you like most about working in your industry or field? So let's start off with Nishant.
I think, I'll start with the more specific radiology field. I think the reason I chose radiology was it's a head to toe field. We deal with disease processes in every single part of the body. Radiologists are anatomic experts, and anatomy was always a favorite course of mine. And then within radiology, a subset of interventional radiology allows us to treat disease. It's only increasing in its sort of frequency and its application. So that's just the pure diversity and constant intellectual challenge was specifically why I chose radiology. But I think, backing up to medicine in general is also extremely diverse. And it's not to say that you have to be a physician to work in medicine. I was fortunate enough to do a dual sort of MD MBA degree at the Darden and University of Virginia Medical School, and that's just the applications of that kind of training or thought processes are innumerable in medicine, and especially the current sort of situation where it's just ripe for change. So you can within within even the business realm, there are subsections. Do you want to focus on organizational change and how you affect change management in hospital systems? Do you want to focus on systems and processes and quality improvement and design a method of improving workflow for a patient, for example? So I think the bottom line is within medicine, if healthcare is interesting to you, you will find a niche within healthcare that you can satisfy, whether it's being a physician, physician assistant, nursing, business, or research, or anything in between.
Wonderful, thank you. And Amy, what do you like most about working in your industry?
I agree with what Nishant was saying. There really is so many more niches than you appreciate going into medical school, that it seems like, well, then you go and you take care of patients, and there's so much more to it. So I love my field. I love pediatric oncology. I love taking care of children who are really sick and really need us. But I also love that I can balance it with teaching, with educating medical students, with writing and being creative and doing research and asking interesting questions. And ultimately improving how we do take care of patients. But it makes for a really good sort of work-life everything balance. And I think that not every field can offer that kind of flexibility and creativity in where you take it.
That's wonderful, thank you. You never get bored, that's good. Wonderful. Kartik, what do you like most about working in your industry?
Well, I think that's it. I think it's never boring. Even there are days when I spend most of my time in the office and I'm working on my computer, it's still, I'm using my brain, and I'm fortunate enough where I am to spend my day talking to people that are really smart and really interesting, sometimes about work, sometimes not about work. And I think that, it's an industry where where you can surround yourself with those kinds of people and you do that for your day. It's pretty cool.
Wonderful. And Kristen?
Yeah, I agree. I mean, I find my job fascinating. I get to take care of children when they're, sick and in the hospital, not so sick that they're in the intensive care unit. My patients all get better and go home. But I get to have encounters with families at those most stressful times, and it challenges me to read and to study and to practice my interpersonal skills. And I love having the opportunity at my position now to teach and work with students. And so I am happy to go to work. I like what I do. And yeah, it's been challenging, but it's opened so many doors for me. And I think pediatrics is the best specialty. So I really like working with families and with kids. So.
That's awesome. All right, so any final advice for University of Virginia students that are interested in working as a physician? Let's start off with you again, Kristen.
I mean, I think my biggest advice looking back and talking to, current college students would just be you have to be well-rounded. You have to take care of yourself. You cannot lose sight of your own physical and mental health in the process of going through the application and the process of medical school and residency and attending. You have to be the best students you encounter, the happiest students, the happiest physicians are the ones that are able to take care of their families and their own physical and mental health. And so that would be one of my biggest recommendations.
That's a really good message. Thank you. And what about you, Kartik?
So I think that, so I don't come from a medical family at all. And so one of the things that I enjoyed about being near a major medical center like UVA when I was an undergrad was to be able to find people who were doing what I wanted to do and ask them how they got where they are, and what are the challenges and what are the pros to do that. So again, with sort of the broad campus and medical center and everybody who's on grounds, I think you can find people who have a job, or connecting through the alumni network, and just ask questions and follow your bliss, I think.
Wonderful, thank you. And Kenneth, can you hear us at all? Do we want to try again? Oh, I think he blacked out again. Okay, so Amy, any final advice on UVA students interested in working as a physician?
I think just generally be open to all of the possibilities, that it's not often we only have, say, a family member who was a physician or our own childhood physician as a role model, but there's so many different directions you can take your career in medicine. And going off what Kristen said, I'll give a piece of advice that I gave my mentee yesterday, which is that work-life balance looks different for everybody. I do a lot of writing at night and it makes me happy. And I like it. I really enjoy that part of my career. And it means that I don't feel bad if I go to something at my son's school for a couple hours during the day, because I know I'm still working hard and being productive. For other people, that kind of academic schedule where your work could always continue really makes them unhappy. That's balance for me, but it's not balance for everybody. And it took me a long time to sort of figure out what was best for me and my family and my life. So I would encourage students to be sort of open to all the possibilities and recognize what would make them happiest.
I think that's a great point. And Nishant, we'll finish with you. Any final advice for UVA students interested in working as a physician?
Whether you choose physician as your career or any other, make sure you're doing it for the right reasons. And like others have echoed, use all the opportunities and the people and the network that you have available at UVA as an undergrad, and if you stay there for future, to really explore all of your options, do it for the right reason. When you get into a career like medicine, it's a lifelong career, it's lifelong learning, and it's a lifelong commitment. So just do it for the right reasons and align your goals with your career aspirations.
Wonderful. Well, I'd like to thank you to all of our guests today. They're all mentors in Virginia Alumni Mentoring. University of Virginia students can log on to alumnimentoring.virginia.edu now and connect with other alumni for additional insights about the process of starting a career in their specific field. Thank you for joining us today, and make sure to check out more career and industry insights on career.virginia.edu. We will see you next time.